There are many types of menstrual disorders. Abnormal uterine bleeding. It is the excessive or prolonged menstrual bleeding. Amenorrhea. The absence of menstrual bleeding. Oligomenorrhea. Light or infrequent menstruation, premenstrual syndrome and premenstrual dysphoric disorder, and the last one is fibroids. What could be the cause of nonstop menstruation? In most cases, the cause is not known. Known causes of abnormal uterine bleeding include polyps, fibroids, endometriosis, medication, infection and some forms of contraception. Treatment can include medications, or dilatation and curettage to remove the uterine lining. Why is my menstrual cycle getting longer? Longer cycles are caused by a lack of regular ovulation. During a normal cycle, it is the fall of progesterone that brings upon bleeding. If a follicle does not mature and ovulate, progesterone is never released and the lining of the uterus continues to build in response to estrogen. How can I stop my menstruation? Many women also experience a natural shortening of their cycle as they age. Take hormonal birth control. Oral birth control pills and the birth control shot can both be used to regulate your cycle. Have sex. Exercise regularly. Take over-the-counter medications. Ditch your tampons. Up your vitamin C. Is it normal to have your period for 10 days? The typical length for menstruation is 3 to 5 days of a 28-day menstrual cycle. A condition of having menstrual bleeding for more than 7 days is called Menorrhagia. This excessive bleeding is obviously not good for the health. However, a recurrent menorrhagia is abnormal and can be a serious medical condition. How long should period last? The menstrual cycle, which is counted from the first day of one period to the first day of the next, isn't the same for every woman. Menstrual flow might occur every 21 to 35 days and last 2 to 7 days. For the first few years after menstruation begins, long cycles are common. What is normal period flow? The usual length of menstrual bleeding is 4 to 6 days. The usual amount of blood loss per period is 10 to 35 milliliters. Each soaked normal-sized tampon or pad holds a teaspoon 5 milliliters of blood. That means it is normal to soak 1 to 7 normal-sized pads or tampons in a whole period. Why is my period not stopping? This imbalance can cause the uterine lining to become too thick. Then, when you get your period, it can take forever for the lining to shed. It could also mean you have uterine polyps, mushroom-like skin tags growing from the walls of your uterus, which can lengthen bleeding. What causes menstrual delay? Missed or late periods happen for many reasons other than pregnancy. Common causes can range from hormonal imbalances to serious medical conditions. If your period doesn't fall within these ranges, it could be because of many reasons. You must consult your doctor. How can I increase my menstrual flow naturally? Consume 1/4 teaspoon of turmeric with milk, honey or jaggery. Take it daily for several weeks or until you see improvement. Do not use this remedy during your periods. Aloe vera helps treat menstrual irregularities naturally by regulating your hormones. Thanks for watching. Please give your feedback and don't forget to subscribe to Health Experts.